Good morning, everybody. My name is Angela. I'm one of the nurse practitioners here at Revitalize. I wanted to come on and talk a little bit more about our hormones. I know last week Dr. Ramsey talked about each hormone, what they do, what they are, and I wanted to get into a little bit of things that can disrupt our hormones. So as you know, all of our sex hormones, they work together, even with our other hormones like vitamin D and thyroid. Now, when that homeostasis is broken, there's a couple reasons. One of the biggest is hormone disrupting chemicals. Some of you may have heard of these. They're really unfortunately everywhere. They're in our physical environment, they're in our personal care products, they're in our food, they're in our water, and a lot of them unfortunately are unavoidable. Now, the biggest problem with these chemicals is many of these chemicals are called xenoestrogens. These are a big group of disrupting chemicals that what they do is they chemically, structurally mimic the natural estrogens, natural hormones that we produce. Now, the problem with this is when the body reads them as so similar to what we inherently create, it can trick the body into thinking it's okay to accept these. So we have hormone receptor sites in our body, specifically estradiol, as most of you are familiar with. So when these synthetic hormones take up those receptor sites, there's no room for our natural hormones to bind. So a couple things can happen. Our hormone systems decide to stop producing them. That's one common imbalance that we see, which of course can manifest in a variety of symptoms, disorders, autoimmune. The other thing is less are produced or they malfunction. So things just don't work in that cohesive homeostasis that they would if we were exposed to a perfect, clean, organic environment, which we all know is very difficult to do. They are also referred to as endocrine disruptors. You've probably heard all the different terminologies, and that is because, like I said, it disrupts our endocrine system. So our endocrine system is what creates our hormones. It's what helps them function, signals our tissues, our organs, our fertility, our thyroid, which communicates with our brain. So it's all very connected, and you can see when they're disrupted, things don't quite work the way they should. So to give you some examples, I know I mentioned personal care products, environment, our household. One of the biggest things that we see is in food. I think that would be, we have some control over. Lots of the, even organic, I shouldn't say organic, lots of the whole foods, if they're not organic, exposed to herbicides, pesticides, those are hormone disruptors. Processed food, anything that's created in a bag that has additives, preservatives, those disrupt our hormones. A really big one, even outside of our food, is in plastics, in BPAs, in phthalates. So I think most of us think, okay, yes, the packaged food, but there's other plastics, single-use plastics in our home. Tupperware. Tupperware is a really big thing. Switching over from plastic Tupperware to glass Tupperware is a big area that you can make an improvement. Plastic water bottles, switching over to something that's stainless steel. So you can see how it starts to get sneaky. They're really everywhere. Stepping out into our own environment, if you're filling up your tank with gas, and I'm not saying not to go get gas or not to do these things. I'm just trying to paint a picture of how our bucket that helps to filter these toxins can easily become overfilled. And when the bucket is overfilled, that's when our symptoms start to manifest. So I think it's important to just educate you so you know what you can change, the controllables. A big one that I like to tell my patients, or especially my female patients, is our personal care products. This is actually where my personal journey began a couple years ago. I started to question what was in my personal care products. I have a vivid memory. I was shopping for sunscreen, and there's so many different sunscreens. I started looking at products. You don't understand what any of them are if you're not familiar or you're not used to looking at labels. So I personally started using, at the time, it was an app called Think Dirty. It was really nice because you can take your iPhone or Android, scan the product barcode, and it gives you a breakdown of every ingredient that's in the sunscreen or the shampoo or conditioner or makeup. The list is never ending. And it tells you exactly what the ingredient is. And at that point, you start to question, okay, why am I putting this on my skin when this is being directly absorbed? And that takes us back to the hormone disruptors. One big ingredient I can tell you, if you aren't aware of this and you're just starting your journey looking at product labels, it can be a little daunting. Fragrance is a really big one that most of us wouldn't expect. So if you're putting on that vanilla lotion that smells so great and then lighting your cinnamon candle, and those are hormone disruptors also. So it's important to not villainize every product, right? But just, again, take control over what you can. So fragrances, really making sure they come from an organic source, so like an essential oil. Those are much more tolerable to our body and don't mimic the estrogens, like I said, like those xenoestrogens. So trying to eliminate the synthetic fragrances. Another source, unfortunately, is our pharmaceuticals. So a lot of pharmaceuticals we need to survive or to manage certain ailments that we have. But unfortunately, these pharmaceuticals can contain synthetic products, or I should say ingredients. A big one being birth control. So we know birth control, that's what it's intended to do. It's intended to disrupt our hormones. Essentially, it turns the ovaries off, and that's the point of it, right? So we can prevent pregnancy. But the problem with that, again, is it's taking up some of those receptor sites for our natural hormones. So things just don't quite work in homeostasis. Another big area where we find these hormone disruptors are our cleaning products. This can be a little overwhelming also, but same thing, just looking at those ingredient labels. One recommendation I can give you, if this is somewhere you're starting, find a company that does it all in one. So I personally use Branch Basics. So I buy a concentrate from them. They give you different bottles. The bottle will be labeled for laundry, for windows, and it's all the same product. It's non-toxic. I don't have to worry about my little boy if he gets a hold of it. It has no fragrance in it, so you're not cleaning, getting a headache, and you just pour a little bit of the concentrate in each bottle. It kind of tells you where to start, and then you add water. I'm not saying you have to use this product. There's several that do this type of system, and you just find an organization or a company that you trust and you know their ingredients, because that's what we're exposing ourselves to every day. Same thing, that company, actually, I use that same concentrate for my laundry. So I know that the clothes I'm putting on every day that I'm exposed to are clean. So it can be very daunting. I think that's the biggest place to start, looking at the food you're eating, the products you're putting in your house, on your body, and then really supporting your liver. So a lot of our hormones are filtered by our liver. So even our natural estrogen processes are filtered by our liver. And when we are exposed to so many of these hormone disruptors, whether that be inevitably or by choice, our liver is the one that has to process them. So again, that I love the bucket analogy. You know, I tried not to preach perfection. I tried to preach doing the best that you can and controlling your controllables, because we all have our vices, right? We all have our something that we really love that we know may not be great for us. So as that bucket starts to fill, and it overflows, that's when we have our symptoms. And everybody's bucket is a different size, based on your environmental exposures, your medical history. So that's where it comes into controlling the controllables. So if you can lower your toxin threshold in that bucket, you're going to have less of that spillover. We'll get into what some of that spillover looks like in future weeks as we break down each hormone, because I could list off several symptoms, that have to do with hormone irregularities, or things as severe as cancer and autoimmune disorders that really can originate from these hormone disruptors and unequal hormones. But really, when it comes down to it, each hormone has really specific signs and symptoms that we can help you pinpoint, similar to what we do in your patient visits. And we'll get into that in future weeks to come. So I hope that was beneficial. I hope that brought you a little bit of information that you can apply to your day-to-day. I I would say if this is new to you and this is all new information, take it very slow. Don't overwhelm yourself by trying to overhaul your entire life in one day, 1 week, 1 month even. Product by product, slowly do what you can. All right, and next week we'll start to break down the hormones one by one. We'll have Taylor Lofton, our nurse practitioner, here to talk about testosterone, talking about what it is, the benefits, potential side effects when we supplement it, and what some imbalances might look like if you are low on testosterone.